I think often we, as clinicians, we want to fix people.
Yeah.
Here's this medication, here's this surgery.
Mm.
But I think, what I'm realizing actually, as I get older and more experienced and also having my own experience, what's most important to people is just being heard, listened to, having their experience validated.
Yeah.
And then, if I read and it's like, Ayana was great, she really listened, I felt understood. I felt hopeful at the end. I give myself a little pat on the back, like literally, actually.
Cool.
and then I feel, I've made a difference to that person. And that's great. And then I carry on and I love what I do.
Hello and welcome to Menopause Whilst Black, Season 8, Episode 2. Menopause Whilst Black, the podcast, is committed to sharing the stories of Black people in any stage of menopause. My name is Karen Arthur. I am an author, an artist, a broadcaster, a grandmother, a mother, and lots more in between. And I'm thrilled to be able to bring yet another episode of Menopause Whilst Black in this season to you. I will let you get ready to hunker down and listen to this episode. And I know that you will enjoy it. If it resonates with you, please share it with people in your networks and do us a favor, like and subscribe this podcast and this episode so that we can reach the ears who really need to hear us. That's enough about me. And that's enough from me, even, which is what I meant to say. You know what? You listen and I'll be back soon. Okay. Enjoy. Hello and welcome to Menopause Whilst Black Season 8. And today my new guest is Dr. Ayana Gibbs. She is a psychiatrist and hormone specialist with over 20 years of experience across the NHS, academia, the pharmaceutical industry, and private practice. She's passionate about improving access to evidence-based mental health care, particularly in women of colour, with a special focus on the intersection of neurodiversity, hormone health, and mental well-being. Ayana trained in psychiatry at the Maudsley Hospital in London, earned a PhD in neuroscience from King's College London, and has authored numerous academic publications. She currently works as a consultant psychiatrist with a specialist focus on adult ADHD, is an honorary clinical senior lecturer of Brighton and Sussex Medical School, and divides her time between the UK and the Caribbean. Dr. Ayana is the founder of the Caribbean Mind and Hormone Clinic, a telemedicine service designed to fill critical gaps in mental health care across the Caribbean. Ayana, welcome.
Thank you, Karen. It's great to be here. The bio sounds so much longer when you're reading it out while I'm here.
No, but it's good. It's
almost endless.
It's important to get it all in. And I'm sure there are bits we've missed out, but all good. It's all good. Yeah. And am I calling you Ayana, Dr. Ayana, Doc, Ms. Gibbs?
Ayana, please.
Ayana,
that's my name.
Absolutely. Just wanted to double check. You never know.
Yeah.
Okay, Ayana, tell us about yourself. Who are you outside of all of your titles?
Well, I am a Guyanese Bajan Brit in that order. My mum is Guyanese, my dad is Bajan. They met at University of the West Indies, Mona, when they were studying. And I was actually conceived in London when they moved to, because my dad was doing a master's there. But then they moved back to Guyana, and I was born. And then when I was around 3, we moved to Barbados, which is where I grew up.
Ah,
And then when I was 18, I moved to the UK for medical school. So that's where the Brits bit comes in.
right.
And it's funny kind of thinking back because I'd actually never been to the UK before. I'd been to the US quite a few times.
Mm,
Quite a few of my parents' siblings live in the US, but I'd never been to the UK. But
mm,
I was adamant that I was going to be independent. And so I
mm.
refused to let my mum come with me. And I remember now, like, you refused. And so she let me go. And I remember getting off the plane at Leeds Bradford Airport
Mm.
in 1993. So you can do the math. But it was a horrible day because I went to Leeds Uni, to Leeds
Mm,
Medical School.
mm.
And it was grey and wet. And I was like, I want my mum. um, but yeah, I mean, I got over it. It took a long time to adjust, actually. It took a while, but then I loved it. And so I spent the first 6 years of my time in the UK in and around Yorkshire, which was wonderful because, it means that I'm one of those people that, does really kind of appreciate the UK outside of London.
Right.
And then I moved to London just over, about 20, well, it'll be 25 years ago this year,
Mm, mm.
to train in psychiatry, and I've pretty
Right.
much been there ever since. But I love traveling.
Mm,
I mean, I love London. It's one of my
mm,
favorite cities. I love the theatre, the museums, food, and the bustle, actually. It's that feeling of, you can be alone, but you're never really alone.
mm, mm.
Or, you can be. There are little oases of calm
Yeah.
that you can find. But then I travel, and yeah, at the moment, I think I'm a real digital nomad. I'm, kind of
Mm.
here, there, and everywhere.
Amazing. And you've just told us about all the different places you've lived and kind of moved, some of the places that you've moved to. And that explains your accent, which one minute it sounds beige and the next minute there's a little bit of Yorkshire coming in there, then there's a little bit of Britain, London, it's all over the place. And you told me to do
Yeah,
the math, but I couldn't. How old are you?
I am going to be 50 this year.
Ah,
Yes,
okay.
but
Oh,
and I
there's
have
a
to get
but.
this
There's always a
in.
but. Go on.
I am still being asked for ID.
Great. Great.
Believe it or not. Well, it hasn't happened in the last year, but this time last year.
So no one's called
Because
you auntie yet,
well, my niece and nephew do call me
but I
auntie.
mean, as just random strangers.
But no, that hasn't happened yet. Yeah, I'm thinking, maybe the next 20.
Oh my goodness me. Well, it's a rite of passage, let me tell you. I remember the first time I was called auntie by a random stranger, and I think I was 45. And they meant it as a term of respect, but I didn't see it that way. I literally looked over my shoulder to see who they were talking to. Now, 20 years later, almost 20 years later, obviously I'm a grandma and, to be called an auntie again.
Well,
But
yeah,
there you go.
exactly. But yeah, and my mum is 80 and she looks incredibly fit.
Mm, mm,
In fact, we've had, is that your sister?
mm, mm, mm.
So I've got that to look forward to, I hope.
Absolutely, absolutely. So, Ayana, who taught you about menopause?
Oh my God. I would love to say that
I
I
love that
learned all about
sigh.
it. Well, there's a story here.
Okay.
And yeah, I mean, I'd love to say it was, I learned all about it at medical school, but I honestly don't recall much at all, apart from, it was this physiological thing that happened at a certain age.
Mm,
And, the implications were mainly to do with fertility,
mm,
but not kind of much beyond that. So, and also, even, it wasn't something that we talked about in the family. I had no idea, when or how, my mum was going through menopause transition. So it wasn't really until I started to experience it. And then it was actually initially, sad to say, Dr. Google. Despite being a physician myself, I had, no awareness that what I was experiencing could be attributable to menopause. And because I guess I had some maybe, well, I don't think they are actually that unusual. Hot flushes, night sweats are probably the most common. But what eventually kind of made me sort of seek help, if you like, was this kind of really weird symptom. I was actually in Barbados at the time. I remember it was, we were just kind of coming out of COVID. So I think it was early 2021 or something like that. And I was getting, what I thought were bites. So, I thought they were mosquitoes. And I was staying, we were staying in a place, my partner and his kids, but no one else was kind of experiencing this. But in the Caribbean, we're like, oh, mosquitoes like some people more than others. They've got sweet blood, blah blah blah. So anyway, I thought it was just, well, for whatever reason, I'm just experiencing this, and it was. It got to the point where it was really uncomfortable because it was happening daily, and then I was quite relieved that I was going to be going back to the UK.
Wow.
So it must have been bad because I was looking forward to going back to London. I was like, okay, well, at least that's one thing that's going to be really better. And then no more of these pesky insects, wherever they are. And I got back to London and it was still happening.
Oh, wow.
And yes. So then, obviously, I realized it wasn't insects. And it kind of progressed to, so it felt like I was being pricked all over my body with pins. And
That's what I was
then,
going to ask you. That's like, what is it? Because I thought you meant you were being bitten. What you mean is you had the sensation of
I
being
thought,
bitten.
yeah,
Right.
exactly. So that's how my brain interpreted it,
Yeah.
because what else could it be?
Mm.
But then clearly it was what we'd call like neuropathic pain. So the nerves are firing, but there's no external or outside stimulus. And so and it also progressed to like this burning sensation, and I felt like cigarettes were being stubbed out on my scalp, particularly. Yeah,
So it
so
was
I
all over your
honestly,
body? Was it all over your
yeah,
body? Was it all
all
over?
over my body. Yeah.
Wow. Mm.
And I honestly felt like I was being tortured. It was
Oh,
horrendous. And, I think also as a medic, I kind of panicked because I'm also a bit of a hypochondriac. And I was like, what's going on? I was like, have I got MS? Have I got some other kind of neurological disorder? And then, so I saw a couple of specialists, well, a few actually. I saw a consultant rheumatologist, I saw a consultant neurologist. They did various investigations, nerve conduction tests. And with Dr. Google, I kind of became convinced that I had a small fiber neuropathy, which is like, sort of disorder of the small nerve fibers. So you can't kind of detect it with the standard nerve conduction tests that they
yeah.
do. So the only way to kind of diagnose it, supposedly, is to do a nerve biopsy. So, so we're like sort of heading towards this nerve biopsy, which then is also going to cost quite a lot because my insurance wasn't going to cover that. So I'm thinking, okay, like is how how necessary is this? And
Yeah.
I'm kind of still Googling, and then I just come across people that are describing just exactly the same thing in the context of perimenopause. It was crazy. I was literally floored. And
That's
then,
wild.
yeah,
It's
yeah,
wild.
And that's me as a doctor.
Yeah, well, this is what I was going to say. So there's a couple of points I want to pick up on. First of all, you described yourself as a hypochondriac. I understand you know yourself better than anybody. But also, it is common for people who are experiencing menopause to have symptoms that aren't necessarily common. And because they don't know about menopause, often think that something's happening. I've heard people say time and time again, I thought I was dying. I thought I had MS. I thought I had, a nerve disease, all that kind of stuff. But what is also wild is that as a doctor, you didn't have that training. It wasn't something that was part of your medical training. How?
But not just that,
Yeah.
Karen, but also, sorry, just to also make the point that none of the specialists that I saw mentioned it or thought about it either. So, yeah, I mean, not just me, but,
No one was
consultant.
joining the dots at all.
No, no.
And this,
Yeah.
okay, so where are you on your menopause journey? Are you perimenopausal?
So I'm actually
Okay.
post-menopausal. So having gone through the peri-menopause journey, I actually then had what we call induced now, or surgical menopause, because I had a hysterectomy
Mm.
2.5 years ago
Mm.
because of fibroids. And that's worth talking about
Yeah.
as well. I
Please
think
do.
it's important because, so, I mean, in terms of the perimenopause journey, I started hormone therapy actually, and the symptoms went away. So
Yeah.
yeah, so I was taking HRT, and I mean, I guess one of the fibroids are very common in Black women,
Mm.
and we don't know for certain, but yeah, there's some suggestion that estrogen can contribute to fibroids getting bigger. So
Yeah.
that's one consideration, I guess,
Yeah.
with hormone therapy. And so that's possibly what was happening with mine. Although it's impossible to say, but it's a consideration. So where they hadn't been particularly problematic. And then also, your menstrual cycle changes during
Yeah.
perimenopause. So there's that aspect as well. It's getting much heavier periods closer together, really heavy, to the
Mm.
point where, I stopped wearing like white because it was just, too risky. So, how much of that is fibroids, how much is the sort of hormonal fluctuations? But you get to a point where it's like just enough.
Mm.
And so I tried various treatments for fibroids in the past, even kind of before perimenopause, that hadn't been particularly effective. And
Mm.
then I think because I was already perimenopausal and taking HRT, it was like, well, I don't need a uterus, I don't need a womb, we can get rid of it and the fibroids.
Mm.
And then the question was raised as to whether or not to have ovaries removed as well.
Okay.
And I think this is so important because, if I think about the state of mind also that I was in at the time. And this is so important for so many women
Yeah.
because when you get to the point where you are being offered or wanting a hysterectomy because of a gynecological condition, things have probably been pretty bad and you're probably pretty, frustrated, pretty desperate. It's clearly not been easy. And so that's the context in which you're making, these significant decisions. And I think, that needs to be better appreciated by the clinicians that are counseling people and also by ourselves. And, I hadn't thought about it. But what was happening at the time was one of my friends from school, from childhood, who I'd actually gone to university with. We were roommates in the first year. She had actually died that summer because of ovarian cancer.
Oh,
And
sorry.
so, yeah, yes, that, and it was really, I think, a shock to a lot of us in that group. But so there was that, and also, my mum was having a hysterectomy as well for. She had an ovarian cyst that it wasn't clear what was going on with that, and it couldn't be properly visualized on scanning. And and she was heading into her 80s, and I was like, well, I don't want to be having to sort of make those kinds of considerations, or have that kind of intervention at that stage. So then when it was put to me, with or without the ovaries, then in the back of my mind, it's like, it was just, just get it all out, no more gynecological cancer risk. But what wasn't discussed, I mean, we did discuss the fact that I was very likely kind of menopausal, but not the fact that actually, although post-menopause, your estrogen and progesterone levels are just declining or non-existent. The decline in testosterone is much more gradual, and your ovaries can continue producing testosterone for quite some time after menopause, and that didn't feature in the discussion, actually. So, and with hindsight, if I had, and now I've done, well, personally, but also professionally, quite a lot of training in perimenopause and menopause and hormone health generally. And so, on balance, with what I know now, I would not have made the decision to have my ovaries removed.
Wow.
I think.
It's difficult, isn't it? Because there's so much to weigh up. Do you have children?
I have two stepchildren from
Right.
a previous relationship. So
Right.
yeah, as far as I'm concerned, yes, they are my children. And
Right.
my current partner has two kids as well. I haven't given birth to
Right. Yeah.
children.
And did you? Because I suppose these are I've spoken to women who have been offered hysterectomies because they were having difficulties with their fibroids, and one of the biggest things is around accepting and acknowledging that when you're getting older, and there's that whole, kind of mental stuff that goes with that, thinking about, and not just physically, but feeling relevant, feeling desirable, all that stuff. But also if you wanted to give birth to children and how it takes that kind of option away from you, how sensitive do you think the people that your consultants were around that issue, or was it something that you were done it, you didn't want to anyway?
Oh, you mean around the issue of having children? Oh, that was not a consideration at that time. That I was not. I was very much
Yeah.
past the stage of that being something that I wanted to
Mm.
do at that point in my
Yeah.
life. So that wasn't, and that was part of the discussion. And I think because it was very clear
Yeah.
from early on that
Mm.
wasn't a consideration for me in particular, there wasn't much of a discussion around that. Yeah.
And it sounds to me that you've done a lot of your own research. Like, a lot of the information that you have is either from stumbling on stuff on Google or doing research as part of your job, like after the fact, in a sense. What are your thoughts?
Uh, yeah, I mean, to some extent, I mean, the information is there. I guess you do have to be careful what sources you use. I guess in terms of my current level of knowledge, I've done quite a lot of actual training in menopause, and I'm doing the British Menopause Society
Right.
specialist training. So I've done quite a lot of their courses and masterclasses. So that's where a lot of that knowledge comes from now.
Yeah.
But you know, their site and Women's Health Concern has a lot of you know, evidence-based information for women that are struggling with decisions around this life stage. So not just, you know, around you know, management of fibroids or other gynecological conditions, but you know, hormone therapy, you know, how to manage it in the context of risk factors that you might have, like cancer risk, etc. So you know, there's information that is available for
Yeah.
you in
Yeah.
making these decisions. It's just also a question of knowing where to look and what
Well,
information
that's
you
the
can
other thing I was
depend
going to
on.
say, is that the research is there and coming, and there's information there, but often it's about knowing what you're going through in the first place and knowing what to look for,
Yes.
you know, and I think that's important as well. Um, yeah, I have questions around whether you discussed menopause with anybody else. You spoke to a lot of specialists, and you spoke to specialists when you didn't know that you were going through menopause and they weren't mentioning it at all. Did you speak with your friends? Did you speak with your partner at the time? How were those conversations? Or did you keep it all to yourself? Which happens?
I spoke, I guess initially, because I didn't realize it was menopause, I spoke to my partner a lot. I was sort of panicking about, you know, what was going on with me and you know, what I might have. And, you know, he was kind of trying to calm me down. Well, you know, just wait, see what the tests
Yeah.
say. But then, you know, when I discovered that it was all uh, related to, you know, hormonal changes, I think I couldn't talk about it enough, because it's like, you know, people need to know
Yeah.
this.
Yeah.
um, and so, yeah, I mean, I certainly talked to my partner quite a bit. I talked to my brother. Actually, I talked to him. I don't have a sister. I just have the one brother.
Mm.
And I talked to my mum, because also I was curious. I wanted to know. Yeah, I wanted to know. You know, had she experienced this,
Yeah.
or you know, what did she go through? And it turns out nothing much, really. She
She
said,
didn't. She
yeah,
didn't have any symptoms, or she doesn't. She just doesn't remember,
no,
or
she said she didn't really.
yeah.
She said she didn't really. And yeah, it was, I think 49 or 50. So, you know, a bit earlier than the average, but we know that Black women are a
Yeah.
bit earlier than, you know, the average in the UK anyway.
Mm-hmm.
So,
Mm-hmm.
then, yeah, but when I talked to her about all, you know, all of my symptoms, and you know, the prickly pain thing, I guess, which is what I call it, was the most unusual,
Yeah.
I suppose. But then I did have some other symptoms that were maybe more characteristic, that I also hadn't necessarily put together
Mm.
with you know, the menopause picture. But migraines were a problem.
Yeah, they're huge. Yeah.
And yeah, and I had, and I think they were sort of menstrual and hormonal,
Mm.
because I had them when I was a teenager, in, you know, adolescence, and then they sort of went away in adulthood, and then suddenly they were back.
With a
uh,
vengeance.
yeah, and
Yeah.
actually, you remember, you know, before I had all these investigations, I was speaking to the GP about migraine, actually, and she said, "Oh, you know, do you have any menopausal symptoms?" And I was like, "No, no, no, nothing, no hot flushes, no night
Yeah.
sweats." And then, you know, that was the end of that conversation,
Mm.
and it didn't occur to me to think about the migraines in that way, in that context.
And also, you wouldn't,
So
you would like, it's all very well saying, do you have any menopausal symptoms? But menopausal symptoms they're getting more. And there are more and more people who are learning about what menopause symptoms are. We are, when I started doing research 4 years, which is not long ago, but 4 years ago, I read 34. The other day I read something like 80. It depends on who's looking, where you're looking. So you wouldn't necessarily know if you have menopausal symptoms. I had really bad toothache, and I didn't know that was related to what was going on with the estrogen and my gums, and I didn't know at the time. So it's about
that's absolutely right.
meeting,
Yeah.
yeah, health professionals who are joining the dots, and hopefully that is getting better. I don't know. What do you think?
Well, I think it definitely is.
Mm.
I do think that I don't know, if I started this journey now,
Yeah.
things would probably be different. There's
Yes.
just so much more awareness
Yeah.
in the last, 3 to 5 years, I guess.
Mm.
But yeah, particularly in the last 3 years.
Yeah.
Um, so, and I think in terms of the people, the women, the patients that I see,
Mm.
predominantly for mental health issues, that there is much more awareness of how they might be linked to
Yeah.
hormonal issues,
Yeah.
and I think we as clinicians are getting better generally as well.
Mm.
Like I sort of call myself a hormone health specialist. Well, there's no such speciality as such, but we recognize that hormone imbalance impacts
Yeah.
a variety of systems
Mm.
and specialties, and so traditionally it was endocrinologists that were dealing with the majority of hormone conditions, diabetes, thyroid, etc. And gynecologists dealing with the sort of reproductive side of things and sex hormones. But I think that as psychiatrists, I think every psychiatrist should be a hormone specialist in terms of being able to assess and manage
Mm.
and treat hormone imbalances with hormone based therapies as appropriate,
Yeah.
because there is so much of an impact of hormones on mental health, well-being, and also pre-existing mental health conditions
Yeah.
then during that transition.
Yeah. Absolutely. And it's about the mind body connection. So it's good to hear that that there is more, not just research, but training and thinking around treating them all together. You work with ADHD, people with ADHD as well. Do you see any overlap between ADHD, people finding out that they have ADHD, and also um, perhaps during perimenopause? There seems to be, or maybe it's just me, but I'm seeing a lot of perimenopausal women in particular um, being going to get tested or being diagnosed with ADHD, didn't realise that they had it. Do you think? What are your thoughts on the links between perimenopause and ADHD for those people who have it?
They are there. They're definitely there. We don't fully understand them,
Mm,
but but we know that they are there.
mm,
Uh, so Attitude magazine, which is like a community support organization, did a big survey in the US, like
mm.
about 5,000 women
Oh, that's big.
who, yeah, were diagnosed with ADHD or reported ADHD. And, the biggest proportion of them, I think it was just over 40%, had been diagnosed or had got that diagnosis between 40 and 50.
Wow.
So in that perimenopausal
Mm.
stage. And there are probably a few contributing factors. I mean, the research is ongoing and
Yeah.
still not fully there.
Mm.
But certainly one is the fact that women in general have been less likely to be diagnosed with ADHD in childhood for various reasons. We think possibly ADHD looks a bit different in girls.
Yeah.
Maybe they're more inattentive, less hyperactive. They're less problematic in terms of behavior, so they're less likely to get referred. So ADHD has been diagnosed like 2 to up to 16 times more frequently. This is in terms of the studies.
Yeah.
In boys and men than in girls and women. But then when you actually look at adults, it's more like 1-to-1. So yeah, getting very much more to 1-to-1. So we've thought that ADHD is just more common in boys, but actually it's looking like maybe it's not. And ADHD just looks different in girls, and the diagnostic criteria have been developed around boys and male samples, and also particularly white male samples.
Yeah.
So that's one aspect in terms of the lack of diagnosis in childhood, but then also girls and women and people that are socialized in that kind of gender role are perhaps better at compensating, masking symptoms, because there are these societal expectations. And particularly then when you look at different cultures and different contexts, and particularly if I think about my own context, and it's probably very difficult to get to adolescence being extremely hyperactive as a girl, as an example. So there are all these considerations, but then of course there's the hormonal aspect, which is increasingly recognized. So the good thing is that there is quite a lot of research ongoing. There's not a lot of evidence at the moment, but there is definitely a correlation between symptoms and hormones, particularly estrogen. And women with ADHD, even in the reproductive years, so before peri-menopause, do often find that their ADHD symptoms fluctuate with their menstrual cycle. So, and it's a bit like PMS, premenstrual syndrome, where in the few days or the week before their period, their symptoms were even worse. The brain fog is worse. The mood symptoms are worse, and that extends to then the perimenopause, when there are these massive fluctuations, and then obviously a decline in estrogen, and that's often when women struggle to compensate. And it's also in the wider context of what's happening at that stage of life. There's maybe teenage kids, there's aging parents, there's potentially stressful jobs. It's that sandwich generation. And so, you've got all these external factors coming together at the same time as you're kind of losing your estrogen. And so, yes. Yes, it does, it does control your mind in a certain kind of way. And so, those coping mechanisms can, break down. And that's one of the reasons as well that, that women may often, start to wonder more about ADHD, or even if they have before, they really want to look into it and perhaps get treatment, because they're just really not coping with that additional burden of, hormonal imbalance.
There's a lot to think about. I mean, I was a teacher for 3 decades, and certainly in the early part of my teaching career, teaching in mixed schools and teaching with boys' schools, you never heard about girls having ADHD. It was never a thing. The focus was always on boys. And so now getting to a stage in 2025, early 2020s, when we're finding out more about the fact that actually it's about presenting. And I think often the way it presents itself across the genders, but also this will be around the fact that when it presents in boys, often it was about behavioural issues, which meant that it was disrupting classes, which meant it was noticed more. Because the whole point of being in
Absolutely.
school was to be able to learn, and you couldn't learn if you were distracted by somebody else. So those kids, in a sense, were moved across to what was then called special needs or taken out of class or that kind of thing. And it really speaks to knowing yourself, knowing, what your triggers are, knowing what your routine is, knowing what, like you said, about what happens just before you have your period, for example, and what your mood goes, what you're craving, that kind of thing. All these things are important for just finding out more about what is best for you as you age and what is best for your menopause care specifically. That's what I wanted to say. I want to take you back a little bit. You mentioned fibroids. You kind of glossed over it a little bit, I'm not going to lie. It's like, fibroids is a big deal, babe. So I had it. So there are a couple of things you said. First of all, you mentioned it. I thought, coming back to that. But also, you said you tried a load of things and they didn't work. So I'm interested in a couple of things. One, what were your symptoms for fibroids, and how long did it take you to get, diagnosed? That kind of thing, that journey. But also, what were the things that you tried that didn't work for you? Because they might not have worked for you, but they might be helpful for other people. Answer in any order.
Yeah. So I found out that I had fibroids incidentally initially because I had a hormonal coil, a Mirena device for contraception, which was fantastic. Actually, it was just the best form of contraception, and I had no periods, which was great. And then it needed to be replaced, so I had it removed. And actually, I didn't have one for a while because with my partner at the time, we were actually thinking about having a child. Okay. But then when I went to have another one put in, they couldn't fit it because there was a fibroid in the way. So it had been a few years. Well, not how long? Maybe sort of 4 or 5 years, possibly. Yeah. Okay. They were probably there, just smaller. And so this one had got particularly big, and because of where it was positioned, it was just really difficult to fit the Mirena. So that's actually how I found that. And to be honest, the most distressing, I know that, that people suffer horrendous symptoms with fibroids. Yeah. But to be fair, my biggest issue at that time was the fact that I couldn't have the Mirena.
Right. Because it's so good as well.
Yes, yeah. So actually, eventually, I did see a community gynecologist that did manage to get it in actually, under ultrasound. So that was fine. But it wasn't until, I guess, in combination with peri-menopause, so hormonal fluctuations, possibly HRT, whatever, that I started to experience the symptoms that I had in terms of the heavy bleeding. But again, is it just fibroids? Is it the peri-menopause? Difficult to say. Yeah. And there was also some pain and discomfort as well. So yes, I mean, I don't think that I suffered with the fibroids as much as many people do, to be honest.
Yeah.
And I had tried, so I tried obviously the Mirena, and that often stops bleeding, well, as it did for me previously for many people, but it
Mm-hmm.
didn't work second time around. I tried progestogen only pills. With hindsight, one option could have been a combination, but anyway, I tried combined as well, and I think it just got to a point where I don't need this apparatus. I I can let's remove it. But there are other options as well.
Yeah. Yeah.
And of course, again, this is sort of my journey and my
Yeah.
perspective, but definitely, you can have discussions with your GP or specialist
Yeah.
about
Yeah.
what might be the next treatment option for you if this hasn't worked. I think actually that's maybe the most important thing to highlight, because I think and I think I had this as well, there is a tendency to get quite frustrated when
Yeah.
things aren't working.
Mm.
When, if I come at it from the clinician angle, there are a lot of steps. There are many things that you can try if
Yeah.
you're willing to persevere. It's just that it's difficult when you're struggling and you're suffering. It's like, I just want it to stop.
Yeah. Yeah. I hear you. I hear you. And yeah, again, important to know yourself and important to know what you want. Some people suffer for years and years and years trying different things, and eventually,
That's
they
true
might opt
too.
for they might opt for myectomy or hysterectomy, but you seem to know yourself well enough to know, you know what, yeah, we're not doing this anymore. Let's move on. Um, you talked about the fact that you take hormone replacement therapy or hormone therapy or medical hormone therapy. It's one of those anyway. Did you agonize? Okay, I take HT, yeah, but I spent years not taking it. And I spent years not taking it because I was worried. I was thinking about the 2000, the old research, and I was worried about getting breast cancer, and I was worried about my mother's opinion, and that kind of thing. And also, I didn't know any Black women who took hormone therapy, and I wondered whether the decision for you was an easy one or whether you were like, no, this is happening.
Yeah, it was very easy. It was this is definitely happening, but it wasn't. Yeah, I should pause, but
No, I'm laughing
um,
because I said this big long thing and then he went, yeah, it was easy.
yeah, I knew what I was going to say,
Yeah.
but I'll tell you why, which is maybe more important. And again, it's my perspective, and it's also about being informed and having access to the right information. But I
Yes.
think for me, it's not then. Well, I guess then particularly, I was just like, I want these symptoms to stop,
Yeah.
and this is what's causing them. This
Yeah.
this lack of estrogen.
Mm.
Um, so we need to replace it.
Mm.
But you know, and that was then, and subsequently, and certainly now, it's also a lot more about the longer term benefits. And I think that's what often gets lost. And, I talk to, have a group of female friends in Barbados, and we talk quite a lot these days about menopause. And, it's always about, the hot flushes and the night sweats, and, how they're sort of affecting the day to day, and one carries a fan, and these kinds of things. But it's more than just the symptomatic relief. It's about, for me, the protection against the cardiovascular risk,
Mm.
because that's the other thing that we forget, that we, I think, well, and society in a way, but as women, understandably, we are very worried about breast cancer
Yeah.
because, okay, yes, that is, the most common cancer in women,
Mm.
but it's not, the biggest cause of death in women. It's
That's right.
cardiovascular disease. It's heart attacks. It's heart disease.
Mm.
And the reality is that your risk of heart disease goes up several fold after menopause,
Mm.
and all the evidence indicates that HRT is protective. So there's that. There's balancing
Yeah.
those risks, and some sort of less well evidenced at this point, but there's a lot more research going on around dementia risk for women,
Mm.
which is higher than for men.
Mm.
And what role does estrogen play in that, and what role does HRT play
Mm.
in in managing that risk?
Yeah.
So I think on balance, for me, I understand the risk when you're thinking of breast cancer, but at the same time, it's small.
Mm.
It is very small.
Mm.
It's not associated with estrogen only therapy, which is another thing to consider. Well, certainly in my case, because I don't have a womb,
Mm.
I don't need progesterone, and on balance, the increased risk is way smaller than many of the other risks, like being overweight,
Mm.
drinking too much alcohol.
Mm.
So it's I think a question of balancing those risks, and I guess that's something that we're not really we're not really taught to do, or we don't. We're often not required to do in a systematic way,
Yeah.
and so it's difficult. I think how do you navigate that if you don't have specialist knowledge or expertise, or
Absolutely.
a background in appraising
Yeah.
scientific literature. And I think it's something that really does need to be more mainstreamed into education. Like, how do you risk appraise? How do you weigh up a risk here over
Yeah.
this similar or bigger risk over there? That's what you need to do, because so often you know friends or other people will say to me, I don't want to take hormone therapy because there's a risk of breast cancer, and I think I'll get breast cancer.
Mm.
Or but it is what it is. It's a risk,
Yeah.
and it's how likely is that to happen?
And
you know
it's personal. It's and as all of
and
these things are, they're very personal. Thank you for that explanation. Yeah,
absolutely.
because I think it's important for people to understand that, and also again, the emphasis on men up until recently, considering how old I am, 62, is that the it was men that got heart attacks, men got strokes.
Mm,
So to be doing this research and learning more about menopause and realizing, wait, what? you know, it's crazy. And I
yeah,
want, like you, want more women to recognize that we need to take heart health seriously, because that shit gonna kill us if we don't, do something about it.
absolutely,
And it's not
absolutely.
just
And
about
so I should,
HT, but also about
yes,
exercise. And, it's not, HT
yeah,
isn't a magic
that's
cure, but certainly
that's
I'm
exactly, yeah,
interested in
what I was just going to say.
how what your thought process was, because mine was long and convoluted, and here we are. You do other things. You
Mm.
don't. I'm talking about how you manage your menopause care. I know you on medication. What else do you do? Do you have a routine? Do you run marathons? What's going on?
Yeah, so I
Yeah,
completely
you run
agree.
marathons. Do you
It's
really
not.
run marathons?
No, I thought about running a marathon once.
Oh wow! And then you had a lie down, and it all went away.
Yeah, but well, I guess. Well, I was in a way I was lucky because I guess I was quite a chubby child and adolescent. So I, yeah, I guess for various reasons, kind of started thinking about, healthy eting and exercise quite early on. I actually remember, because I'm a child of the 80s, I was watching Oprah. And I think this was towards the end of the 80s, where she'd done a lot of shedding, and she was talking about her 20 grams of fat max a day. And and I'm watching, I'm like, okay. And obviously, and I've never gone for bad diets particularly since, but there is something about it that then actually gets you thinking, at least, about intake, and then also output, because she was talking about exercise. And I remember I'd be like, okay, I actually start reading nutrition labels, which is a useful thing to do. Quite. And and then I'd be in the backyard, skipping and doing some knee ups and things. So, but there were times when I was less healthy. Certainly when I moved to university, and up late studying, and I'd be eating like a packet of chocolate digestives. But I think exercise has always been pretty central. Like whatever form I did, I did quite a lot of aerobics at uni in the 90s. But then I think it was in my mid-20s, I did actually start running. I'm not sure why. And that felt like torture to begin with. Like it was horrible. It's like, why would anyone do this? And I could only run for like 15 minutes before I felt like dying. But it was good that I did it at that stage. Because, and then the goal was, I was like, okay, so I'm gonna do a marathon. And I started to, that was, because it's good to have a goal as well, I think. It helps to focus the mind. But as I started to build up the distance, I actually got knee pain, like my right knee. It's now kind of long-standing, and I think it's just like a gait issue. I've had some physio and talked to podiatrists and things, but then I was like, well, I like my knees more. and that is the thing about running. It's not great for your joints, but I still do it. So I do it regularly. So that's probably been the most consistent form of exercise that I've done since my 20s. And so initially I would do like 10K, maybe 3 times a week. And now it's down to 5. And
that's pretty good though.
At the moment. Yeah. And it depends on where I am, but yes, when I'm in London, so I'm in Shoreditch, I'll run along the canal, and then when I'm in Barbados, I'll run along the boardwalk
at 5 o'clock in the morning, because it's so damn hot.
Well, exactly.
I mean, I'm not complaining about the heat in Barbados. I just know that when I'm there and I run, it has to be as early as is humanly possible.
Yeah, definitely. So in terms of routine in London, it's usually just around 12, a bit just before lunch. So I do some work in the morning, go for a run. But in Barbados, it's first thing for sure. And then I do, I've lapsed from time to time, but at the moment I'm doing quite a lot more weight training, because you just have to.
This is my current fixation.
As you get old. Otherwise you just waste away.
This is my current fixation. I did a live earlier on today with Michelle Griffith Robinson, Olympian and PT and coach. And it was very funny. We talked about the importance of weight training for menopause, and then she had me get up and do some exercise and was checking my form and stuff like that. It's very funny. It's on Instagram if anybody wants to on menopause.
Okay, I'm definitely after this.
Of course, I was complaining all the way, but it was really helpful. And what was interesting, more to the point, is that so many women tuned in and was interested in this particular topic, because weight training is something that many of us who've reached menopause have been grown up in the time when you're supposed to be tiny and delicate and, that kind of thing. And if you weight train, you thought that you were going to bulk up and you were going to look like a man and you were going to look strong. Whereas we now realize that for menopause, weight training may be one of the most important exercises that you choose to do. As my little, I'll get off my soapbox now.
Absolutely. No, oh yeah, second that 100%.
Oh, that's it.
Yeah. So that's my routine. And and then I have periods where I will do more of other forms of exercise. Like I got into hot yoga, to Bikram
You're
for a
making a
while,
face. Why are you
which
making a face? Do you like it?
oh, I wasn't. It's funny. It must be sort of subconscious, but I actually stopped because I dislocated my shoulder. So, like, I
Oh,
wasn't consciously thinking about that, but
oh, okay. All right.
but I did. I did actually after Bikram class dislocate my shoulder. But anyway, that's another story. But
Oh my
maybe
God.
that's the subliminal face message coming out. But other than that, I really enjoy it in terms of flexibility and strength, actually, because also it's quite the heat. It feels quite cardiovascular as
Yeah.
well.
Yeah.
It's,
True. True.
that, and I've discovered Pilates, reformer Pilates, which is
Oh, where
great.
do you do yours? In London
So
or
I
in
actually do it
Barbados?
in Barbados.
Yeah,
Yeah, I do.
I follow somebody in Barbados who does who has a reformer Pilates studio. I'll look them up and put them in the show notes. But I love reformer.
Yes, I think it's Red Zen. I
Right,
think
I'll write that down.
that's where
Cool.
I go. Yeah.
You do a lot, Ayana.
Hmm.
I don't just mean exercise. I mean generally. You have a busy life, and you're living between countries, and you are doing lots of things. How do you celebrate yourself? Expecting that response.
Oh my god. Yeah. Oh well, it's because like at the risk of I don't know how this will sound, but anyway, this is my little celebration. I I actually read patient feedback.
Okay. In the
uh,
8 seasons of Menopause Whilst Back, that is the first celebration I've heard. Do carry on.
it's just, you know, I think often we as clinicians, we want to fix people.
Yeah.
And, it's like, oh, here's this medication, here's this surgery.
Mm.
But I think, what I'm realizing actually, as I get older and more experienced, and also having my own experience, a lot of the time, what's most important to people is just being heard, listened to, having their experience validated.
Yeah.
And then, if I read and it's like, Ayana was great, she really listened, I felt understood,
Mm.
I felt hopeful at the end. I give myself a little pat on the back, like literally, actually.
Beautiful.
And then I feel, I've made a difference to that person.
Mm.
And that's great. And then I carry on and I love what I do.
I think that's beautiful. And the reason I think it's beautiful is one that you remember to do that because so often, you know, you are making a difference to people. And yet sometimes it's easy. Our little brain focuses on one negative thing out of like 200 amazing things. And so to remember to go back and look at the praise and read the feedback and make yourself and understand that you are making a difference and that you are valued, what you're doing is valued and you are valued is a beautiful thing, and it's a lesson to us all, I think. So thank you for sharing that. I'm sorry I laughed. But
Yeah, but you feel bad now.
yeah, I take it all back. I feel really bad now.
No, I was thinking, oh god, this is going to sound really sad.
No, it's lovely. It's lovely. Do you have a tune? Do you like dancing? Which tune? My question is, which tune instantly makes you dance? And I will say, I
Oh
always
my
assume
God.
people love dancing because I do.
Yes, well, I do. I do, because, well, yeah, I'm West Indian. Maybe, well, where do I fit in? Anyway, favorite tune, one that really makes me want to dance. Probably Come Home, I think. Yeah, because actually it's symbolic
Who's it
for
by,
two
first of
reasons.
all?
So it's Nyla Blackman. It's a soca tune.
Okay,
Nyla Blackman, who's a Trinidadian soca
okay,
artist, and Skinny Fabulous, who's Vincentian.
great.
And it's from Carnival 2023, so symbolic because, yeah, it was the first carnival after COVID.
Yes,
So, yeah, there hadn't been any for 2 years. So, it's basically, yeah, a homage to Carnival and celebrating the return of Carnival.
I love
So
that.
it's just such a feel good tune, and lyrically like really beautiful as well. So it was one of the two Road March contenders that lost
Okay.
out to the other one. But it's also symbolic for me because although I grew up in Barbados,
Mm.
I'd done carnival, crop over in
Yeah,
Barbados,
yeah.
but I'd never been to Trinidad for carnival.
Hmm.
So it was a first, and it was also like not just after, but 6 months, just after 6 months after the hysterectomy. I
Mm.
had the surgery in September, end of September, and then carnival was in February, and that was like actually the goal then, because I was thinking, am I going to be ready? Am I going to be fit? Not just for the distance, but also for the you've seen
Yeah.
the costumes, right? It's like,
Right.
but a friend of mine was turning 50 that year as well,
Mm.
and she wanted to go.
Mm.
And so I was like, yeah, let's do it. I'll be ready. And so then as soon as I could, like I did lots of exercise, in the kind of immediate aftermath, like exercise that I could do, like lots
Yeah,
of walking. But
yeah.
then as soon as I could kind of go back to the gym and to more active stuff, I
Mm.
got a personal trainer. I was like, let's do this.
Yeah, let's go. I'm going to
and
Canada.
and I was coming home
Love
with
that. Thank you
carnival.
for sharing that about the song. I'm going to have a listen after we finish recording. Um,
Yeah,
Final question.
that's a goodie.
Final question.
Oh.
What's the one piece of advice you would give to any woman listening to us right now?
I laugh. I mean, okay, I can laugh now, but I'm gonna say. I mean, you will have got this from previous bits of the discussion, but I'm gonna say it again because it's worth reinforcing. Don't get rid of your ovaries.
Wow.
That's yeah. I mean, and we've talked about the context, and again, it's an individual decision, and there may be very good reasons
Yeah,
for having your ovaries out at the same time that you're having a hysterectomy,
yeah,
and by all means. But if it's a question of you know hysterectomy plus or minus ovaries,
mm,
oh, I'll just get the lot out,
yeah,
don't do it.
yeah,
um, or at least think about it in a considered way. And
yeah.
it's difficult because, as I said, there's a lot going on at
Mm,
those times. But
mm,
yeah, they're like, yeah, an old car, maybe, your
yeah,
ovaries, if you like,
yeah,
in peri-menopause, they might let you down and break down a
mm,
few times,
mm,
but you'll still get some use out of
yeah.
them. So hang on to them.
That's
Yeah,
that's that's good to
that's
know.
what I would say.
That's good to know. Thank you. Thank you for sharing that. I have to tell you, as this podcast has progressed, your voice, your Bayesian accent has come out more and more. It's fascinating. You now sound like my cousin Laura. I'm like, "Cool, when did Laura enter the chat?"
That's so funny.
But I
Because
think
it's not,
maybe we
well, when
should
I'm
have
in
had.
Barbados, it happens. But yeah, it's not like you sound Bajan, or is that what's happened? Have you started sounding more Bajan?
Maybe. I don't even know. I hope to be able to meet you in person when I come to Barbados in April
Yeah, let's
for a
do
retreat.
it.
So let's
For
make an
sure.
absolute plan to do that. And I want you to take me to the best place to get a rum punch. I'm very excited. Forget the whole, going best place to have, fish cakes or any of that. I want rum punch.
Okay, yeah, we'll do it for sure.
Oh, thank you. What's in the pipeline and where can people reach out to you?
Oh, pipeline. Yes.
Yeah,
So
that
I am.
pipeline. Remember that? The bit where you
Yes.
yeah.
Yeah, I typically forgot about that. So in the pipeline is a book on ADHD in Black women that I'm co-authoring. Yes, with Stephanie
Amazing.
Uslo and Jessica Kingsley Publishers. So it will cover, you know, ADHD A to Z
Mm,
basics,
mm,
um, you know, what we understand about the cause,
mm.
diagnosis, treatment, but also with a specific lens or perspective for Black women.
Yeah,
In terms of the cultural context
yeah.
and the way it manifests, issues that are perhaps more specific or relevant to Black women
Mm,
around, the fact that also with
yeah.
earlier menopause, and
Mm.
also, I mean, we haven't discussed this, but there's a link between ADHD and premature or early menopause.
Well, we're waiting
Um,
for that book. We are waiting for that
yeah.
book then. When's it due out? Do you know? Oh, you're writing it.
So it still needs to be completed
Okay.
and
All right.
published.
Well, hurry up.
So yeah, it's so yeah, we're looking at sort of late next year.
Okay. Okay.
So definitely in the pipeline.
Right. And if people want to contact you or follow you or, stalk, not stalk you, you know what I mean?
Yes, no stalking. But yeah, so website
Okay.
drayanagibbs.com, Insta, yeah, drayanagibbs.com. And
Okay.
also there's the Caribbean Mind and Hormone Clinic, cmhclinic.com as
Brilliant.
well. And we're on Instagram as well.
Oh, brilliant. Fantastic. Thank you. Thank you, Ayana. I hope you have the
It's
most
been such a
wonderful
pleasure.
weekend when it comes. Oh, I'm glad. I'm glad. I loved the conversation with Dr. Ayana, because she was really talking about something I'm fascinated by, which is the links between ADHD and the onset of perimenopause and how there is a correlation. And I'm thrilled that she is in the process of writing a book that is specifically about ADHD in Black women. Um, I'm wondering if you have had an ADHD diagnosis or whether you're someone who has noticed that your symptoms have started to exacerbate as you've hit perimenopause. Um, do let me know. My email address is hello@menopausewhilstblack.com. And you can get in contact with Dr. Ayana Gibbs on her website and on her socials as well. She's a really fascinating woman to talk to with a lot of knowledge. This week, I had the privilege and honour of meeting with some of the women from the first cohort of the Joy Retreat Barbados, and it's been 2 years. It's been almost 2 years, and it was so lovely to meet up with them. We met up at a restaurant in South Bank, and just were able to catch up and relive some of the wonderful moments we had at the Joy Retreat. The doors for 2025 are now closed, but if you are interested in being on the wait list for the next Joy Retreat, which will take place in 2026, then do drop me an email. Make the subject title The Joy Retreat, to hello@menopausewhilstblack.com, and I will make sure that you are added to the mailing list so you are the first person to find out about what's what. Yeah. And in the UK, if you're listening from somewhere else, we had Mother's Day on Sunday. And I know that Mother's Day can be very difficult for many, many more of my friends I'm noticing. So I just want to send some love and some thoughts to those who long to be mothers, who've lost mothers, who have difficult mother and child relationships, who didn't really know their mothers, or who have lost children, because Mother's Day can be a difficult time. And I really hope that you are being gentle with yourself and have been gentle with yourself, particularly on that day. This episode is one of many in the Menopause Whilst Black library. If you're new to us, we have over 70 episodes for you to go through. And I would love for you to listen to them, to share them, to like and subscribe, so that we can reach the ears that need to hear us. There are so many more people out there across demographics who need to know more about menopause. And I've been talking recently to people who are understanding that the millennials and the people behind us are not going to be hit by menopause in the same way that people my age were in their 50s and 60s, because they know so much more. They are absolutely speaking up for themselves, absolutely not taking a no for an answer, and learning to advocate for themselves, but also learning about themselves so they can have a better transition and an easier experience. And that's the key, isn't it? The key is to know yourself, know the foods that cause you issues, write things down, track your periods, either track them by using various apps like Flow or Stella, or many other period tracker apps out there, or go old school and get a bit of paper and a pen and a journal and write those things down. The more you understand yourself, the more you understand what works and doesn't work for you, the easier it will be. My journey with weight training continues. I had a moment last week where I was like, oh, actually, I'm getting used to this. So I'm trying to be more consistent. And I think it's starting to pay dividends. So if there's any exercise that you started to do that you hated it, and it started to become something of a routine so that it gets better, I would love to hear from you, because for me, I thought weight training was my nemesis, but understanding that it is super important for me to maintain my muscle strength, build my muscle strength, and have some kind of functionality in terms of as I get older, so that if I fall, first of all, I'm less likely to fall, but if I do fall, that I don't hurt myself too much, or that I recover better, and to stave off osteoporosis. Then for some reason that turned it around for me, and so I'm sticking at it. That's it from me. The sun's shining outside. I am going to go outside, go for a walk, get some daylight in my eyes. Don't forget to wear your SPF now that the days are getting lighter. Thank goodness. I feel like I've actually woken up now after 2 months sleeping. Wear your SPF, drink your water, get your protein in, and enjoy yourself. Have a great day, a great evening, a great week, and I'll speak to you soon. All right, take care. Bye.